This is Dr. Kevin Ivory. We are now entering the last portion of the class and moving into the study of psychoacoustics. Psychoacoustics deals with the perceptual aspects associated with hearing. This last section will be divided into a few lecture casts derived from the old ComD 401 Acoustics of Speech and Hearing. For these few lecture casts, again, we will have a guest lecturer, Dr. Peter Ivory. I'll return as your principal lecturer for the last lecture cast, which will be dealing on binaural hearing. Additionally, please note, you will have the opportunity to answer some questions from chapters 13 and 14 of our textbook as bonus questions on the final exam. You will be provided with study questions for that material.
So here we are at psychoacoustics. Psychoacoustics is a branch of a general area of physics known as psychophysics. In psychophysics, investigators, scientists, other interested people look to find the connections, the relationships between the perceptual world and the physical world. Psychoacoustics is that specific sub-branch, that sub-science that looks at and studies the perceptual aspects of sound. Psychoacoustics is important to us in communication disorders because it provides a lot of the basic information and basic scientific, if you will, measurement strategies for hearing assessment and other aspects of what we have to deal with in audiology and in auditory rehabilitation. Some terminology. Sensation. Sensation is the awareness of an external stimulus or some change in the body that was caused by an external stimulus. So a very clear example is hearing something. If you hear a particular sound, that's a sensation. It's an external stimulus coming from some external source, but yet you're able to detect it. By distinction, perception is a little bit more than that. It actually includes recognition and interpretation of a stimulus that was probably based on previous experience. So hearing a specific musical instrument playing a note is a perceptual experience. The basic ideas of sensation and perception have been around for thousands of years. So the basically ancient philosophers that were dealing with how do we discover the world were talking in terms of sensation and perception. If we throw these two words together in a cobbled together expression called sensory perception, we build this slide number 6, which describes two basic assumptions that are very important. This is an important slide. Sensory perception is based on two assumptions. Number one, the individual experiences some attribute of the stimulus. So what this tells us is that knowledge of stimulus attributes are going to be important because they're going to be somewhat determinant of what our sensory experience is going to be. That's point number one. Point number two, our understanding of an individual's sensory experience can only be based on our knowledge and quantification of the stimulus that was used in that measurement. Maybe this is a little tricky, but it falls back to the idea that since hearing is something that happens in your brain, for example, it's not directly measurable. We can make some indirect measurements of it, but the fact is, it's not directly measurable. What, in fact, is directly measurable is the acoustic stimulus. So our knowledge of how an individual, how a typical human responds to different characteristics of acoustic stimuli are based on manipulations to the acoustic stimuli and observations of how the individual responds to those changes. So, key point again, our ability to make statements about individuals' sensation is tied to our capacity and our ability to quantify the stimulus. And that's why acoustics is very important to everything basically having to do with hearing and anything that has to do with audiology. Without it, we don't really have a physical science linkage to the regular world. So two important concepts here. Some other things that are sort of terminology for you to get used to. Measurement of sensation is also referred to as a psychophysical measurement. So again, the psychophysical is the psycho is the perceptual, the physical is the physical. So in a measurement of how do we perceive things in the environment, that's a psychophysical measurement. In psychophysical measurements, we use some kind of test stimulus, and for hearing, those would be sounds or acoustic stimuli, or visual images if we're doing visual testing. Taking this concept further in psychophysical measurement, the human responds to stimuli with judgments. That is to say, they make some judgment about the presence or absence, for example, of an auditory stimulus. If we're talking about a test paradigm, a psychophysical measurement that's involving an auditory stimulus, an acoustic stimulus, the person that is responding to that stimulus can be called a listener. As stated on a couple slides ago, it really is very much easier to measure the physical characteristics of a stimulus than it is to measure the psychological characteristics of a stimulus. And there'll be a couple slides coming up, not in this exact part, but in part 2 perhaps, I think, is where there's a little bit more of elaboration on the variables that affect the psychological, perceptual side of any stimulus encounter that a human might have. So, for example, if we want to measure the physical intensity of a sound, we have devices to do that. And a principal device that does that is called a sound level meter. You could all acquire for your phones, for your handheld phones, you could get probably for free a sound level meter app. And that would allow you to turn that on, and you'd get a measurement in decibel sound pressure level. Exactly how accurate it would be, I'm not exactly aware, but it would be reasonably close, I would suppose. And so you could measure intensity of sound fairly easily with a device and an app that could be built into your phone. In contrast, measuring the loudness of a sound is much more complicated from a measurement point of view. Now, this slide implies, but didn't directly say, that there is in fact a relationship between the intensity or amplitude of a sound, which is the physical characteristic, and the loudness of a sound, which is the psychoacoustic characteristic of that sound. So loudness is our perceptual experience, the perceptual experience that we have with the intensity of a sound, with the intensity, the physical acoustic intensity of a sound. That experience that we have is called loudness. They're not exactly the same. They are very much related. And when we think about human responses to stimuli, there are many variables that can affect that response. And again, part of this slide set will go through that. It's important to always bear in mind that when we have a discussion of any acoustic signal, any acoustic stimulus, there are 3 dimensions that apply that it's important to be mindful of. One would be amplitude, the second would be frequency, and the third would be time, or some aspect of the temporal domain of the acoustic signal. We usually think of this as the duration of a stimulus. But we have these 3 physical attributes which have some interplay that affects perception, but these are the 3 physical dimensions that are applicable to every acoustic signal. We can make some very simplified, generalized observations in psychoacoustics as follows. We can talk about what happens with an intensity increase. And with an intensity increase, we would expect there to be a loudness increase, because intensity and loudness are linked. This one's the physical. This one is the psychoacoustic. or the perceptual. Likewise, we have a pairing of frequency, which is physical. That's the physical domain. We can measure that if we had the correct device. And we have the psychophysical correlate of frequency, which we call pitch. We'll talk about this in Lecture 12B, I think. We can talk about the duration of a sound, and this is, again, the physical characteristic, is duration. And we can perceive this as the amount of time that the signal is on. And there's one final one in which has the physical name of spectral complexity, which is kind of ambiguous. So spectral complexity simply means that frequency is changing over time. And there is a perceptual characteristic. It's spelled Timbre, but it's pronounced timbre, is usually the way that I hear that pronounced. And timbre is more or less associated with what you might think of as sound quality changes. Another way to think of what timbre is the difference between a violin playing a note and a clarinet playing that same note. There's a difference in the two notes and how they sound, and one would be recognizable as a violin, or the other would be recognizable as a clarinet, but in fact they would be differed on their timbre sorts of characteristics. When we look at the areas of interest in psychoacoustics, there are really a lot, but what we're going to be thinking about in ComD 4000 are just several of these. We're going to be looking at principally 5 main things across the next few slide sets. First one is sensitivity. Sensitivity has to do with detectability, the detection of something. We're going to talk about absolute sensitivity, which references what's the least amount of a stimulus we can detect. And we're going to talk about differential sensitivity, which is what's the least amount of a difference between two stimuli that we can detect. Obviously, with these, we're thinking all about acoustic stimuli. So, on the one hand, a test of absolute sensitivity will look at some aspect of the acoustic signal. Most commonly, its amplitude. So we're going to say what's the least amount of the amplitude of an auditory or acoustic signal that a human can detect. In contrast, differential sensitivity would ask what's the smallest or least amount of difference between two amplitudes of a signal that a human could detect. So those are important, and we'll talk about why that's important later. Other characteristics or other aspects of interest in psychoacoustics that we'll talk about. Loudness perception, and again, I've already laid out that loudness is the perceptual correlate to the intensity of a signal. Pitch perception, which again is the perceptual correlate to frequency. A couple of other areas that we'll pick up in that same area of pitch perception. And then finally, we will conclude our treatment of psychoacoustics with a discussion of binaural hearing. Binaural hearing is hearing with two ears, and we'll lay out some advantages of having two ears, and we will talk about how is it that humans can localize, or that is to say, detect in a sound field where the source of the sound is. Also, in communication disorders, we're interested in something that's been described as a perceptual skills development. And in perceptual skills development, there's a very orderly perceptual hierarchy. One of the persons that is noted for writing about this is an Australian audiologist by the name of Norman Erber, who has written about this many years ago now. But this is an important hierarchy for you to be aware of, because if we're going to be training children, for example, to learn how to listen and to learn how to perceive sounds, very young children who are having to listen possibly with cochlear implants or with hearing aids, they've got to follow an orderly perceptual hierarchy. It begins with and is dependent on the lowest level of the hierarchy, which is detection or awareness of an acoustic stimulus. Following that, the next highest thing would be discriminating, which is to be able to tell what's same or different, to be able to tell differences among stimuli. Third level, which is higher yet, is the ability now to recognize and identify sounds, events by their sound signatures. So sounds, and to be able to know that sound, whatever it was, that was a dog barking, versus another sound which was somebody coming through a door here in a second, a doorbell or whatever it may be. That's important. And then the highest level of this perceptual, auditory perceptual hierarchy is comprehension, the ability to understand a particular acoustic message, and this is the basis for words and spoken language, that we're able to not only recognize it as a word, but now we're able to understand it, and that word has a meaning that can be stored and shared, and that becomes a very important part of language. On this particular note, we'll adjourn part 1, and we will return. This was slide 16. We will return to slide 17 and begin to talk about sensitivity in part 2.